Om Dhanvantariye Namaha, Shri Gurubhyo Namaha. Namaste and a very warm welcome to this wonderful session. I am Dr. Lavanya and I am honored to be host for today's enlightening webinar on Ayurveda practice, beautifully organized by Team Ayuryana. With humility and respect, I bow down to all the revered gurus and esteemed guests present here today. It's my honor to welcome our distinguished guest speaker, Dr. Shriram Murtugudde, the organizer, Dr. Radha Chetana, and our enthusiastic audience to today's session. I would like to introduce Ayuryana. Ayuryana is a holistic platform that brings together diverse activities, fostering a unique blend of learning, exploration, and a community engagement. Initiatives include online and offline classes and workshops, informative articles and health tips, health-focused camps and events, recreational activities and excursion for students, individuals with physically challenges, seniors, and the general public. Sustainable tourism programs such as ecotourism and agritourism, Ayuryana proudly blend tradition with innovation. Events and activities incorporate traditional practices, local cuisine, and rural games. It's inspired by the timeless principles of Ayuryana, thread moral, cultural, and traditional values into every experience, creating a rich tapestry of heritage and wellness. Now I would like to brief about webinar. Webinar series on Ayurveda practice is a free webinar series conducted on every weekend for an hour, which is telecasted live on Ayurveda YouTube channel. Don't forget to like, share, and subscribe the channel. The motto is to empower the Ayurveda fraternity to excel in clinical practice and sustainability through the innovative approaches in Ayurveda entrepreneurship. Now I request Dr. Radha ma'am to introduce our today's speaker, Dr. Shriram Murtugudde sir.
Thank you, Dr. Lavanya. Namaste all. I'm happy to introduce my classmate, Dr. Shriram Murtugudde V from Murtugudde, Dakshina Kannada. He completed UG from SDM College of Ayurveda, Udupi. Post-graduation in Samhita and Siddhanta from Government Ayurveda Medical College, Mysuru. He is into Ayurveda clinical practice since 9 years and academic teaching since 4 years. Work for framing COVID Ayush treatment protocol for Government of Karnataka under guidance of Dr. Lakshmi Narayan Shanai, Assistant Director, Government Ayurveda Research Center, Mysuru. Presented 6 papers at national and international seminar, published 4 articles in Ayurveda journals. Presently working at Prasanna Ayurveda Medical College, Beltangadi, Dakshin Kannada. His motto is to promote Samhita guided clinical practice. I heartily welcome you, Dr. Shriram. I request audience to drop your doubts on chat box. Our sir will clarify at the end. I once again welcome you, Dr. Shriram, and the mic is yours.
Thank you. So I think so. The screen is visible.
Yeah, it's visible.
Okay. Good evening to all. Shuddha Spatika Sankasham, Shuddha Vidya Pradayakam, Shuddham Sachidanandam, Sadashivam Maham Bhaje. So basically, it's a very good initiative by Ayuryana to conduct such webinars weekly, which happens to be a very innovative, and many of the people can stay at their home, get and be informed about number of happenings in and around, and they can keep themselves updated. So I'm glad that I got a chance to present myself and my opinion on the clinical practice. Basically, I'm into practice since almost 8-9 years, and this presentation of the next 1 hour is intended mainly for the people who are newly into clinical practice and who feel difficulty to update the Ayurveda clinical practice, or for the UGs and the PGs who in recent future shall start their clinical practice. Okay. Now, when you come to the clinical practice, I have told it is Samhita guided clinical practice. Now, when I say Samhita guided, what does basically that Samhita guided means? Nowadays, there is a concept of hybridization. Now, when I say hybridization, the concept of Samhitas are looked into through the lens of the contemporary science or the allopathic science. Wherein the clarity is not so well appreciable and there are a lot of ambiguity, lot of confusions which happen. The principles of the two sciences are similar at many of the instances and they also differ at number of instances. Just to quote a simple example, when we consider milk or Shira, it is a Shreshta Pittahara Dravya as per Ayurveda. Whereas when we consider milk as per the contemporary sciences, they say it is protein rich and there are chances that it may trigger gastritis. Now, what to do in such ambiguity? So, hybridization has led to such ambiguity, especially in the students or in the initial days practitioners. Now, from my side, or what I practice is Samhita based. That is, whenever there is an ambiguity, what Shastra says, that is the ultimate. So, moving into the core topic, that is basically what is the need of the Samhita guided clinical practice. Now, Samhitas happen to be the basic guidelines which need to be implemented. Now, when we say clinical practice and when we say Ayurveda clinical practice, for us, Aptopadesha or the basic literature are the Samhitas. And the Samhitas have been written for Trivida Shishya Buddhi. Trivida Shishya Buddhi, Alpa Buddhi, Madhyama Buddhi, and Uttama Buddhi. And the description says that this text, what has been written, if implemented as it is, then also you'll get the response. That is, it is for Alpa Buddhi. He says, Etavanto hi alam Alpa Buddhi nam vyavaharaya. Alam samartham Alpa Buddhi nam vyavaharaya. It is a frank thing that we have to accept that we all are of Alpa Buddhi. And Alpa Buddhi nam vyavaharaya, vyavahara chikitsa vyapara. For chikitsa, the text has given certain description. And this description is for Alpa Buddhi also, wherein what description you have, you implement that into practice, you get the response. So basically this text or the Samhitas, they basically happen to be the clinical guidelines wherein which need to be implemented. Fine. So Samhitas, they are Aptopadesha, they are the guidelines for clinical practice. Secondly, avoid being misled by hybrid thought. As I told, the hybridization for diagnosis, we hybridize. When we think of the medicine, we think we hybridize the issue. For example, if I say a person is suffering with osteoarthritis or OA knee, then we directly jump into the diagnosis as Sandhigata Vata. But in the prevailing clinical condition or in that particular patient, whether that osteoarthritis, OA knee, is in the avastha of Sandhigata Vata, or whether it is in Sama avastha, or whether it is Astyabhuta Vata, these are all the different clinical presentations. From the contemporary aspect, the disease is one. But when we take up Chikitsa from Ayurveda aspect, the diagnosis should also be as per the Ayurveda, and even the planning the Chikitsa should go hand in hand with the Vyadi Namakarna or with the disease and the Samprati what we trace into. So, for all this, if hybrid thought is followed as such, when we say ONE, we directly land up or we directly adopt the Chikitsa of Sandhigata Vata, which most of the time is not fruitful or we don't get the response, and we say that Ayurveda is not practical, Ayurveda is not relevant. The thing is, of course, the syllabus has been also framed in a very similar manner. Raj Yakshma is directly related to tuberculosis, etc. So, because of this hybridization, though there are a lot of similarities, there are dissimilarities also. When we think of the medicines, the drugs, the whole concept of Ayurveda is based on Rasapanchaka, whereas nowadays we are thinking in the form of an individual chemical component and its utility as in the form of antihypertensive, analgesic, etc. etc. Such hybrid thoughts are also not fruitful every time. So whenever the hybrid thoughts are misleading, the best way or the best guide for us happens to be the Samhitas. So this is another need for the Samhita guided clinical practice. Third, to be ethically on the right ground. When I say to be ethically on the right ground, nowadays the whole clinical practice or the issue has been very transparent, and there are people of other streams who want to criticize people of Ayurveda. People of Ayurveda, they go into allopathic practice, and yes, they're criticized. Then the diagnosis is based on allopathic science. Even the treatment is based on allopathic science. Merely drug is changed. Instead of giving iron supplements, we give Punarna Mondara, we give Loha Sava, we claim it to be Ayurveda. But that is not. To be ethically on right grounds means for the treatment what you plan, you should be able to produce a valid document as why you have adopted this principle or why you have adopted this case. To be ethically on the right ground, you need a solid proof or a literature for that Samhita guided practice is again a favorable thing. So with these needs, it is time and it is essential to go with the Samhita guided clinical practice. So with the discussion, we'll just take up three of the cases. One case relating to Jora, another relating to the Stanya Dushti, the third case of a Kshatakshina. So we'll go through the details and we'll discuss about this. And as I told, this is mainly meant for the initial practitioners or for the UGs and the PGs who want to start the clinical practice in the recent future. So they'll be having a doubt usually as how to initiate or how to implement Samhita into practice. Should I know the whole Samhita and all the set of shlokas by heart? So such queries will be there. So I'll just try to give you a simple note or a method as how you can initiate into clinical practice. Okay. So we'll take up the cases. The first case is of Jora. So it was a female patient, aged 21 years, complaining of fever, throat pain since one day. Now she consulted me, and this happened to be my initial set of medicine, which is Vyadhi Pratineka. Of course, this prescription is not Samhita based. This was what my teacher used to follow. So I gave her with Mrityunjay Rasa, Sutasheka Rasa, Amrutarishta in the dosage of 1 TID tablets and Amrutarishta in the dosage of 10 ml TID. After 3 days, the fever did not subside. And she consulted, obviously, the patients are like, if they try Ayurveda, if not, then they go with allopathy. They try allopathy, if it does not succeed, they go with Ayurveda, homeopathy. So they keep on changing the stream of medicine. It's very common and well appreciated thing now. And this student, this lady, this girl, she happened to be a student of BMS. Okay. Now, after 3 days, as she did not get relief from the fever, her family members, they forced her to consult allopath. So when she consulted allopath, as she had already was suffering with fever since 3 days, they subjected her for a set of investigations. And the investigations shows that the TC are bit low and the neutrophils are low and the lymphocytes are a bit higher, whereas the typhoid and the dengue test showed negative. This is a simple viral infection, which is which can be well appreciated with this reports. Okay. Now, she was admitted in IPD for 3 days since she had a very high degree of temperature. And she was put on IV fluids and the whole set of antibiotics, etc. So after 3 days of IP treatment, she was discharged and she was in home. And at that time, she texted me. She sent a WhatsApp message saying that, "Sir, I have underwent 3 days of admission. Like I was admitted in allopathic hospital for some 3 days. Now I have been discharged and I am in home, but I am completely bedridden. I cannot wake up. I am having severe giddiness. I cannot wake up from the bed. I'm having severe cough with expectoration, breathing difficulty, and even in being in home, I have been put on IV fluids. Now, this was the condition of the patient when she texted me on WhatsApp, and she told that she has been given with these of the medicines for to be continued in home. That is tab goods of Pandi, Dolo, etc., which happen to be antibiotic, antacids, NSAID, cough suppressants, and antihistamines. Now, since my medication for 3 days, further on she underwent IP admission. She got her blood investigation done for the second time. By this time, she had lost complete hope over allopathic and Ayurveda completely. She was like, I don't have any hope in any other of the medicines. If you can help me somehow, sir, please help me. Then I asked her complaints again. So the present complaints were severe weakness with giddiness. That is, she told that she cannot even wake up from the bed. She has giddiness even while sleeping. Okay, so severe was the weakness and the giddiness. Cough with expectoration and breathing difficulty. She told she could not sleep at night because of continuous episodes of cough and breathing difficulty, and nausea and excess of thirst. She told she's her mouth, her lips, tongue, throat, everything is completely dry. She cannot drink water. If she takes any food, any little quantity of fluids, she feels nauseating. She feels like vomiting it out everything. Now, here is where I started. Like I thought I had to Samhita has to be referred, and we have to go according. Since cough was the main complaint along with this, see, observe that she has not complained of fever. She told she is afebrile as of now. So cough was main complaint, breathing difficulty, a lot of giddiness and weakness. So considering this, I referred into Kasa Chikitsa of Samhita, wherein as she initially had febrile illness, I referred into the Kasa to see if any of the Kasa presented with Jwara. And when I correlated the Lakshanas, maybe Vata, Pitta or Shleshma or among the Panchavidha Kasa, no Kasa Lakshanas matched very well with her presenting complaints. Then I thought of Jwara, and rather than going with Vata, Pitta, the Shleshma, the Jwara, I went with the concept of that Ama Jwara, Pachamana Jwara, etc. And when I referred it to the reference of Pachamana Jwara in Charaka Chikitsa 3rd Adhyaya, the reference says, Jwara Vego Adhikaha Trushna Pralapaha Shwasanam Brahmaha Malapravrittihi Utkleshaha Pachamanasya Lakshana. So this was the reference wherein her clinical conditions matched or mimicked very closely. She had excess of thirst. Then Jwara Vego Adhikaha, he says. Jwara Vega Adhikaha. We'll take up this discussion. Jwara Vega Adhika. Basically, she is afebrile now. She is saying that her body temperature is absolutely normal. She is afebrile. But considering Jwara, if we consider Jwara, then Santapo Deha Manasa. Santapa happens to be the basic lakshana which needs to be appreciated. But here that symptom of Jwara Vega is not there. Rest of the lakshanas, she is having excess thirst and shwasanam, breathing difficulty, giddiness is there, mala pravritti. So that is when the personal history was asked, she told that her bowels are regular and normal. Utklesha, that is she is having severe nauseating feeling also. Then now considering all these lakshanas, Pachamana Jwara was almost confirmed, but the query was with Jwara Vega Adhika. So when we consider Jwara Vega, the patient observed herself to be afebrile or with normal body temperature. Now, this is where the present day contemporary science needs to be thought of. So she was on NSAIDs, or what we call the some of the drugs like the paracetamol or the diclofenac, aceclofenac, etc. So these NSAIDs, which happen to be antipyretic, right? So they mask the symptom. So when you give paracetamol or any of the NSAID, the body temperature will reduce. When you palpate the body, the temperature seems to be very normal. But that does not mean that individual is febrile. Then how to identify whether there is Jwara Samprapti still persisting or not? For that, because of a practice of so many with so many patients, I have observed this one fact. We need to go for Nadi Pariksha, wherein when you palpate the Nadi, you can feel the pulse rate is higher. The pulse rate is higher, and the pulse usually will have a sharp spike. So it is not like the pulse can be felt very sharply, and the pulse rate will be usually very high. And if in this case, if the body temperature is normal, then you need to ask the patient, have you taken any of the tablets? Have you taken any of the medication for fever? Usually the patient initially rejects to accept it. They say that no, I haven't taken any treatment or any medicine. Why? Because they have a phobia or a fear that if they accept that they have taken some tablet, they may think the consultant may say that, may scold the patient for taking medication without any valid medical advice. Secondly, nowadays, taking those paracetamol or any of the NSAIDs, the patient community, they do not feel that it as a treatment at all. They feel it's a normal tablet, just a paracetamol, etc. Dolo, right? So they do not seem to be it to be a part of treatment, and they simply merely forget that they have taken some tablet. You re-question them. You need to affirm. You need to say strongly that no, your pulse is saying that you have taken some tablet. This, when you say this, the patient, it's very interesting. The patient will be surprised that, oh, this doctor, he simply palpated my pulse, he held my pulse, and he could know that I have taken some tablet. Secondly, this also creates a weird sort of confidence. The patient will have a confidence over the doctor that he palpated my pulse, that he held my pulse, and he could identify that I had taken some tablet, which even he himself had either forgotten or he was not willing to accept that. So when you do this, the patient will second time they'll usually accept, yes sir, I had taken that. So since even this girl, she was on NSAIDs, her temperature was very normal. But when the pulse was palpated, and as I told, she is a student of BMS, so she could palpate her own pulse, and she told, yes sir, the pulse rate is high, and I can feel the sharpness of the pulse. So this, though the Jwara Vega is not in the form of a Santapa, it's essential that in present day clinical practice, Jwara is not merely Santapa. Santapa is not appreciable. Why? Because some of the NSAIDs or these of the anti-pyretic drugs, they suppress the temperature or they mask the temperature, whereas the pathology of febrile illness still persists. Okay. So this is one issue wherein Jwara Vego Adhikaha. So among the lakshanas of Pachamana Jwara, wherein Jwara Vego Adhikaha was not appreciable, now we can even appreciate that. So all the lakshanas of Pachamana Jwara are well appreciated in this case. Second, this is usually my consideration. Whenever you have Jwara, assessing bowel movements. So when the individual is in Amad Jwara, Mala Sangha is observed, the individual will have constipated bowel for a day or 2 days or 3 days. Once the individual will have normal stools or normal bowel movements, then 3 of the interpretations, one, either it is Pachamana Jwara or Jirna Jwara or Jwara Mukti. Okay. Jwara Mukti, why I say this is, when you give a medication of 3 or 4 days, the patient comes to you after 3 days. He says that I'm feeling better, but still I'm having a lot of tiredness. Temperature is normal. Then you will be in confusion whether to continue medicine, whether to stop medicine, or whether to change the medicine. So my simple approach there is, I ask the patient whether he or she has passed the stools, whether the bowel movements are normal. If the bowel movements are normal, it means that it implies that the Jataragni is in Diptavastha, Vata is in Anulomagati, Mutra, Mala, Vata, Pravritti, if it is happening normally, then it means that the body is now in a phase that it can recover on its own. So it means that you can either complete that course of medicine of 3 or 5 days, whatever, and you can stop the medicine, or you can stop the medicine immediately. There is no need to change or continue the medicine. But if the patient says that he or she is not having a regular bowel movement, like if the bowel movements are still constipated, then just reconsider, then think whether to change the medicine or to continue the medicine until Jwara Mukti. So bowel movements, occurrence of bowel movements, I consider it as critical in the assessment of Jwara Mukti. So if the individual is, if there are normal bowel movements, it means that the medication can either be stopped or there is no need to change or continue the medication. Whereas here in case of Pachamana Jwara, the bowel movements were regular. Okay, so but other lakshanas of Jwara etc. were already were there, so treatment was essential. So with again through the Samhita guidance, we have diagnosed this case as the Pachamana Jwara, a phase of Jwara. So from Amavastha to it has reached to the Pachamana Jwara. Okay. No. Coming to the treatment aspect. So since she had already completed 3 or 4 days of allopathic medicine, which includes antibiotics. Antibiotics should not be stopped within 3 days. If the patient has already started, at least the 3 days of course of antibiotic has to be completed. Don't stop it abruptly in the middle. So she had already completed 4 days of medication. So I asked her to stop the medicines. And when the consultation happened, like the chat happened, it was almost 8:30 in the night. So preferably I felt I cannot advise her any medicine wherein she has to go to the market and buy it. So easily available home remedy or the drug which can be prepared easily in home, such medicine was preferred. And with this consideration, the chikitsa was planned based on the concept of the Mahakashayas. Now, Mahakashayas is described in Charaka Sutrasthana 4th Adhyaya. It is also there in Ashtanga Sangraha also. In Charaka Sutrasthana 4th Adhyaya, you have 50 Mahakashayas, wherein Mahakashayas refers to a set of 10 drugs prescribed or described towards one Vyadi. For example, you have Shamahara, Jwarahara, Shvaituhara, Kasahara, Shwasahara. Similarly, you have for 50 set different ganas of Dravyasarga. Now, look at the placement of this Adhyaya, Mahakashayas. It is in Charaka Sutra 4th Adhyaya, where in the 4th Adhyaya, the students are not yet introduced to the Vyadhi as such. That is, the students they do not have any clue about the disease. Forget about the categorization into Vata, Pitta, Kapha, Asama, Nirama, etc. They're literally clueless about the disease, but he has given the prescription for the disorders. Maybe in the form of Jwara, etc. Number of things are. Now, what is the implication of this? This implies that this set of Mahakashayas, set of 10 Dravya, which are indicated for one Vyadhi, they can be used by any individual without much of the thought. This is what I told Alpa Buddhinam Vyavaharaya. That is an individual of Alpa Buddhi who feels that I don't know Samhita, I don't know anything. Still, you merely choose one drug which is available from that Mahakashaya and administer it. If more than one drug is available, fine, you combine them, administer. If all 10 drugs are available, fine, you combine them, administer. if number of Gana Dravyas are to be combined, take care that if there are any common Dravyas, pick that common Dravya and then administer that Dravya. Or you can make combination of those Ganas. You have complete freedom. You have complete freedom. You need to just know what Kasa is, what Jora is, what Shwasa is, what Shwaita is. The term meaning, you administer that, you get the best of the response. And this is not from my pocket. Charaka says, he says, Alpa Buddhinam Vyavaharaya. This is for an individual of Alpa Buddhi, for Vyavahara, for clinical implementation. Don't think anything, whether it is Vatacha, Pittacha, Kafacha, whether it's right medicine or wrong. Charaka, he states that you blindly give this medicine, it will work, trust me. And it happens so. So those set of Mahakashas, clinically, when you don't know anything, when you don't know what step to take forward, then these Mahakashas are very useful and they literally act wonder. Okay. Now, considering the main complaints of this lady, that is Jora, Kasa, and she had severe weakness and giddiness. So Shama, that is considering these three lakshanas, we have ganas for all these three. That is Jorahara, Kasahara, and Shamahara Mahakasha. Now, what I did was I thought of choosing one dravya which is easily available in home and which can be which is common among all these three. Okay. Basically, actually, I went through the Charaka Chikitsa, Pachamana Chara Chikitsa, Katuki, etc. Has been told all those drugs are not available in home. So I wanted something which is a home remedy like thing. So when I consider this Jwarahara, Kasahara, Shamahara, Mahakashayas, Draksha or raisins, dry grapes, raisins. So it happened to be a common dravya among these three Mahakasha, Draksha. Okay. I asked her, do you have Draksha in home? She told yes. So fine. So what I told her is just to soak some 15 to 20 raisins, that is Draksha, around 2 glasses of water, around 200 ml, and then soak that for some 15-20 minutes or some half an hour, boil it, and reduce that 2 glasses into 1 glass. I usually, of course, reducing from 2 glass to 1 glass is not a classical method of making kashaya, but for the patient community, to make it simplified, if you tell them reduce it to 1/4, 1/8, it will be a tedious job for them. So reducing to half, and when you give a fresh kashaya, this reduction is usually sufficient enough as per my experience. Okay. So I asked her to soak some 15 to 20 raisins and then soak it for 15 to 20 minutes, make kashaya out of it, boil it, reduce it to half, and that kashaya has to be taken 3 times in a day, morning, noon, and night. And along with this draksha kashaya, I advise her to take 50 ml of dhanya kahima. Dhanya kahima, again, it's a very simple home remedy. Pratah sasharkaraha peyo himo dhanyaka sambhavaha antardaham tata krishna jayet soto vishodanaha. So it is a very good pittahara dravya. So dhanyaka churna, that is, it will be available in home, every home. Dhanyaka will be there. Around 1 spoon of dhanyaka powder has to be taken. Add it to 1 glass of around 100 ml or 150 ml of water. So keep it for overnight. Morning, just filter it and then add 1 spoon of sugar to it. Then drink it. OD once a day. That is sufficient, more than enough. Okay. Now, Draksha Kashaya and Dhanya Kahima, which is literally a home remedy. This was planned through the Samhita based, right? Now, the response was by 2 doses of medicine. I told you the online consultation or the WhatsApp consultation happened in the evening, that is around 8:30. She took a dosage of Draksha Kashaya on that day night. And next day morning also, she took 1 dose. And by 8:30 in the next day morning, she responded saying that the severity of cough has reduced and she could have a good sleep at night. And the medicine was continued. The same medications were continued for another 2 days. And after 2 days, the patient was completely normal. She had recovered completely. Now, just look at the clinical situation. 2 days prior, when she texted me, she was in a situation where she was bedridden. I mean, she was on bed with IV fluids, severe giddiness, where she could not even wake up, breathing difficulty, cough. Simple remedy, Draksha Kasha, Dhanya Karma, duration of 2 days gave a tremendous response. So this is the WhatsApp chat. I know this is not a very formal method of giving the proof, but this was how it happened. So you can see if the on the screen if it is visible clearly. The consultation happened on 15th September. On 16th September morning, she texted and she told, "Ninne ashtondaka firliga." So people who can understand the Kannada, it is easy for them. So she gave a response that yesterday she had a good sleep, like she did not have episodes of cough much. The severity of cough had reduced. Next day on 17th night, I asked her the response again. She responded at night 10. She is like full ready agidini sir. So this is what the response is. That is, by 2 days, the person who was completely ill, who was not in a situation to wake up, is now well set. And just for interest, like this message is very interesting. Go through the last message there. He said, antibiotics, drips, anta nanna chuchi hakidru bere. Now, this is the suffering what patients go through. That is because of the IV fluids, etc., etc. The IV injections, antibiotics, the patient will have a lot of suffering, a lot of pain. In such condition, when you give this sort of a simple remedy of Draksha Kashaya or Dhanya Karma, which is purely classical based, and the patient recovers by 2 days, and she is a student of BMS, just look at the confidence what she might have got over the Shastra, and look how happy she feels. Right now, if you can get the same response in the patient community, then Ayurveda can flourish like anything. Right. So what I meant to say is, mere just appreciate the principles told in Ayurveda, appreciate those principles, apply it. Guduchi is one of the best known Jaradna Dravya. Guduchi has not been administered here, except Draksha. I did not go into any researches or anything which says that, which I did not expect any proof from the modern medicine for to say that Draksha is antipyretic. No. Shastra said Draksha is a Joradna Dravya, Draksha is a Kasahara Dravya, Draksha is a Shamara Dravya. What else you need? Just implement that, bring that into practice. You'll get the response. You need to just have trust over the Shastra, apply it, you'll get the response. And that is what he said, Mantravate tat sampaditavyam amimamsa katanchana. Don't have any doubt over the prescriptions what I give. You just prescribe it, you just give it and wait for the wonders to happen, and it happens. So Samhita based practice is essential. So you have to implement that. Fine. We'll go with the next case. This is of Stanya Dushti, a very interesting. So this happened to be my cousin as such. So she called me with the complaint that her 6 months old child is having cough with expectoration, loss of appetite. That is, his son, her son is not showing any interest towards the breast milk, right? And then he is having vomiting. Even if he wants to drink the milk, soon after drinking, he omits out everything. So this was the complaint: cough with expectoration, loss of appetite, and vomiting since almost 1 week. So whenever the children are in any of the issues, people they want to go to allopath, they don't have to take any risk. So she consulted the pediatrician. He prescribed some set of antibiotics, antiemetics, and after 4 days of medication, the child showed no response. Okay. Now, this is where Ayurveda has got a very unique approach. Very unique approach. Most of the time, we translate Kaumara Britya into pediatrics, but Kaumara Britya and pediatrics are quite different. Why? Because when you define Kaumara, he says Dushtasthanya Graha Samuthanam cha Vyadhinam Upashanam. Dushtasthanya, mother's milk, or mother also happens to be a part of treatment approach in Kaumara Britya, whereas the concept of Stanya Dushti is nowhere in pediatrics. There is consideration of breast milk quantitatively, but qualitatively, to my knowledge, there is no much approach. But this is a unique approach of Ayurveda, wherein they give the description of a Stanya Dushti. What are the outcome of Dushita Stanya? So in this case, this approach of Stanya Dushti was thought of, and I just did the Stanya Pariksha. And the Pariksha of Stanya is again a very simple thing. What you need to do is take a bowl of water, and the mother has to extract her milk, and a few drops of that milk or few spoon of that milk has to be dropped into this bowl of water, and observe for the milk. If when you add that milk, if it settles in the bottom of the water, and if it has some streak or 3D appearance, it is a Shleshma Dushta Stanya. If it is having yellowish nature, excess of yellowish nature, then it is a Pitta Dushta Stanya. If the same Kshir, if it floats on water, more of frothy in nature, then it is Vata Dushta Stanya. When you add that milk to water, if it gets completely mixed with the water in the homogeneous form, then it is Prakrita Stanya. Now, this issue is, this video is not of the same individual. The video is of some other patient, but this video is just for reference as how Stanya Pariksha is done and what is the Lakshanas and how you can observe that. Okay, so this is not of the same individual. Okay, fine. I'll just play this video, try to observe this. So there is a glass bowl wherein there's water in this, and a few drops of Stanya has been dropped into it. Now just observe that the Stanya is not getting completely mixed with water there, right? So you can see that water and milk is separate. Now whether it is floating in water, whether it is sedimented in water, we'll see to that. Okay. So the Stanya Pariksha is very simple. What you need is just a bowl of water and the sample of the mother's milk. That is more than enough. There is no expenditure. There is no expenditure, but it's very relevant. Now we can see here in this video, you can see that the layer, there is the milk has settled at the bottom, and there is a clear layer of water above. That is, this is what is avasadi. Avasadi is where the milk gets settled in the bottom. It does not get completely mixed. If it is a prakrita stanya, it has to get completely mixed with the water. But this is avasadi, when the milk gets sedimented or it gets settled at the bottom. So this, of course, this video is of some other individual. In this patient which I am discussing, her breast milk also had the same sort of presentation where it got settled at the bottom. Along with that, there was streaks which was observed. Now, when we go through the Shleshma Dushta Stanya Lakshanas, this is from Charaka Sharira Sthana 8th Adhyaya. There he says, Tantu Mad Udaka Patre Avasidat Shleshma Vikaranam Kartru. Shleshma Vikaranam Kartru, it is a cause for Shleshma Vikarin whom? It is cause for Shleshma Vikarin child. Now, this is very interesting, wherein the mother comes with the complaint of child. You are assessing mother's milk and you are giving treatment to the mother there. You will not treat the child. Nowhere you treat the child. No medicine is administered to the child here. Why? The cause is in the mother. The cause is Stanya Dushti. You need to administer medicine to the mother. And interestingly, most of the time, when there is a Stanya Dushti, the mother will not have any Lakshanas. Though it is a Shleshma Dushta Stanya, the mother will not have Shleshma Lakshanas. It is the child will be suffering with Shleshmacha Lakshanas like cough with expectoration, loss of appetite, and even the vomiting. So, in this case, this is the very interesting aspect wherein the sufferer is child, you are inspecting in the mother and you are treating the mother, the response you see in child, a very unique contribution, a very unique concept of Ayurveda, which is much very interesting, right? So the observation which was done was the milk settled at the bottom of the bowl and streaks or thread-like appearance was seen. So the diagnosis here is that it is Kapaja or Shleshmaja Stanya Dushti. So obviously everything we are going through the classical reference. So when we go through the chikitsa again, as I told you, no Kashyapa Samhita is required. Basic chikitsa. You have Stanya Shodhana Mahakashaya. Pata, Mahaushada, Suradaru Musta, Murva, Guduchi, Vatsaka Falak, Kirata Tikta, Katukurohini, Sariva, iti Dashimani, Stanya Shodhanani Bhavanti. So these are the set of Stanya Shodhana Dravya. Irrespective of dosha, you can give that, but I choose Mahaushada, which is a Shunti, and the other dravya is Musta, in the form of Mustakarishta. So Shunti Churna, half a spoon, BD, was administered to the mother along with milk. Since we are targeting stanya, I gave it with milk. You may say that Kshira is Shleshmakara, no issues. Fine. Then Mustakarishta was given in the dosage of 10 ml BD for a duration of 5 days. Now, after 3 days, the mother called and she told the child is now fine, no cough, no vomiting. The patient appetite, the child's appetite has increased. The child cries for milk and he is able to drink sufficient quantity of milk. Simple. See, this Shunti Churna Mustakarishta will cost you around 80 rupees. Shunti Churna, it will be available in home. The patient can afford it very easily. You simply get response with simple medications. Right? Now, this is the power of Samhita based or Samhita guided clinical practice. With very simple approaches, very simple medications, you can bring response. And what else you require, right? So this is a very practical method. Fine. Now we'll go with the third case, that is of Kshatakshina. Again, a very interesting one. A couple had no issues, that is, they did not have any children since 4 years of married life. The female partner had no traceable abnormalities either from the sonological point of view or from the symptomatic point of view. The male partner semen analysis showed abnormal sperm morphology. Again, I don't have the reports as the report was sent to me on WhatsApp and I have missed it. Okay. So the what I remember is the semen analysis showed that there were abnormal sperm morphology. Now, when I asked about the history of that male partner, he has history of gym workout, that is he goes to gym and he does exercise or he does workout there for around 90 minutes every day. That's 1.5 hours, and this has been done since almost around 3 years or more. And when you register yourself to gym, you will be prescribed with a certain set of diet which is protein rich, and like this sprouted grains, paneer, then the whey protein, etc. Now the same was instructed to him also. What you can observe in this is, one, he is been administered with paneer, sprouted grains. Sprouted grains basically is virudadanya. Virudadanya is virudha, it is apatya. Sprouted grains is absolute apatya, it is not advisable. And it is asatmya to him. Paneer and all, see, we people of Karnataka or southern India, we are not much accustomed to paneer, whereas the people of Punjab, Delhi, the northern India, they are much accustomed to paneer, etc. So basically, paneer once a while you have absolutely no problem eating it regularly. Shastra says that paneer, morata, etc. They are tridoshakara, they are balya, they are balakara, they are balya, but they are tridoshakara also. So once a while you go to a hotel, restaurant, you want to have paneer, fine, absolutely, no issues. But regularly having paneer is asatmya ahara. It leads to a lot of vikram. So what we can observe in this case is, one, ati vyayama, second is asatmya bhojana or apatya ahara. Now I have quoted that it as ati vyayama. Why do I consider it as ati vyayama? Then what is the matra of vyayama? We know that there is a concept of ardha shakti vyayama. Ardha Shakti Vyayama, the text says, like the translation is half of one's individual strength. Now, how to measure that half of the individual strength? Ardha Shakti Vyayama, the Lakshana of Ardha Shakti Vyayama as described by Bhagbata and Charaka is in relation to Sweda Pravrutti. So when there is Sweda Pravrutti through Lalata, Kaksha, etc., it means that is during the course of Vyayama. It means that it is Ardha Shakti Vyayama. Now, considering the places like Dakshin Kannada, Udupi, where it is so hot and humid that you need not do exercise. Merely sleeping on bed, you sweat like anything. Now, how do you consider Ardha Shakti Vyayama there? There, Sushruta's opinion happens to be more practical. He says, Rudhisthana stito vayuhu yada vakram prapadyate vyayamam kurvato jantos tad balardhasya lakshanam. Rudhisthana stito vayuhu yada vakram prapadyate yada Rudhisthana stito vayuhu vakram prapadyate. When the vakram mouth, when the vata starts moving through mouth, that is when the individual starts breathing through mouth, when he starts panting, when he starts breathing heavily, he starts breathing through his mouth, that is the intense or Ardha Shakti Vyayama. That is the maximum intensity of Vyayama what individual can practice, that is Ardha Shakti Vyayama. Now further with the details of Ardha Shakti Vyayama, Ardha Shakti Vyayama has been indicated in 6 months of a year. He says, Shita Kale Vasante cha Mandameva Tato Anyada. Vagbata says, Shita Kale Vasante cha. That is, Ardha Shakti Vyayama is indicated during Shita Kale. When you say Shita Kale, it is Hemanta and Shishirutu and Vasanta. So Shita Kale Vasante cha. That is, if you consider one Rutu to be of 2 months, then in 6 months of a year, you can go with this maximum intensity, that is Ardha Shakti, wherein the individual starts breathing through mouth. He has to stop that exercise. Further, he says, person who is Balavan and who is Snigdha Bhoji, right? Only a person who is Balavan and who takes Snigdha Ahara, he is supposed to practice Ardha Shakti Vyayama during Shita Kala and Vasanta. So there is Ahara mentioned for Ardha Shakti Vyayama. The Ahara mentioned is Snigdha Ahara, Snigdha Bhoji, that is some sort of a sneha in the form of Grita, Taila, Dadhi, Shira are to be there in the diet. When these are not there, rather you go with the protein-rich diet, is not considered as sneha. So the individual is not taking sneha yukta ahara. Over that, he is not following that Vyayama limit. Okay. Now, when you think of the gym activity, basically gym activity is not considered as Vyayama. You go through the reference of Charaka Samhita Sutrasthan 7th, there he defines Vyayama. Sharira Cheshta, Ya Cheshta, Stairyartha, Balavardhini, Deha Vyayama Sankhyata, Matrayatam Samachare. Sharira Cheshta, Ya Cheshta means Ya Che Ishta. Ishta, which is comfortable, wherein Chakrapani defines Bhara Haranadi Anishta Cheshta Nirasyati. We are excluding Bhara Harana, lifting heavy weights which are not comfortable to the body. It is not considered as Vyayama. This is what is done in gym. The body is trained to such an extent that it is beyond the individual's comfort level. Though he starts breathing through the mouth, they continue to exercise for hours. There is a hypoxic atmosphere in the gym. Over that, they do that Ati Vyayama, not just for 6 months, for whole throughout the year, and they continue for years. And over that, they are taking asatmya, apatya ahara, paneer, sprouted grains, etc. The total, there is dushti of dhatus. So there is Ati Vyayam which has been happened. There is another part which is Asatmya Bhojana. Now we are discussing about Ati Vyayama, and the individual is having abnormality in the sperm morphology. Now what is the relation? We'll go through the reference of Kshatakshina. Kshatakshina, wherein he says because of Urakshata the individual is Kshina. When you go through the hetu of that Kshatakshina, it is all the practical references of Ati Vyayama which were prevalent then, that is running excessively, running with the horse, fighting with elephant, etc. he has told. So there in the Samprakyanal he defines Uro Virujjate, Tasya Bidhyate, Atha Vibhajyate, etc. Go through the last line, there he says, Sa Kshataha Kshiyate Atyartham Tatha Shukra Ojasau Kshayat. There is Kshata and also there is Shukra and Ojakshaya. Because of that, Kshiyate, the dhatus undergo Kshaya. So, because of Ati Vyayama, again, this is the inference what you draw. This is not a very direct reference. This is a bit complicated case. This is not a direct reference what you are deriving here. Here, because in Kshatakshina, that there is one event in the Samprapti of Kshatakshina, the event in the Samprapti, one event that which may happen is Shukrakshaya, Pojakshaya. That is, this is the Samprapti what is happening in this individual. Because of Ati Vyayama, Apatya Ahara, he is having Shukrakshaya. Shukrakshaya here or Shukra Dushti is here in the form of abnormal sperm morphologies. Now, planning the Chikitsa, out of Ati Vyayama, Urakshata, Shukraksha and Pochaksha, this is the discussion what we have done. Further, the Chikitsa for Asatmya Bhojana, Shodhana happens to be the prime Chikitsa. And for we have to follow the Kshatakshina Chikitsa. For Kshatakshina, there is no Shodhana mentioned. It's all Rasayana Kalpas, Brahmana Dravyas which has been mentioned there. But now the individual has come with fertility issue, Vajikarana. Before Rasayana or Vajikarana, it is essential that you need to subject the patient for Shodhana. Secondly, one of the hetu is Asatmya Ahita Bhojana. Shodhana again happens to be essential. Considering that, we planned the Shodhana. So course of Vamana was done. Actually, after the course of Vamana, we had planned for a course of Virechana too. Okay. So a course of Vamana was done. And after the course of with Kalyanaka Grita, which says again, Kalyanaka Grita is a Shreshta Pumsavana Karyadravya. Okay. So in Kalyanaka Grita, you get that reference. So considering the Pumsavanatva, when I said Pumsavana, again, I don't take the meaning of the medicine for male child. It's having a lot of other implication. So it is a Pumsavana Karadravya. So Snehapana was given with Kalyanaka Grita, and then Vamana was done. And after Vamana, we thought of giving him a gap of 1.5 months, and then we'll subject him for Virechana. Meanwhile, in that gap, we planned for Amrita Prasha Grita. Amrita Prasha Grita is a Grita Kalpa, Sarpi Kalpa mentioned in the Kshatakshina Chikitsa. And why we planned for this was the Falashruti of this Amrita Prasha Grita says that it is Putradam. So why in Kshatakshina is Putradam important? Why? Because one of the outcome of that Kshatakshina Samprapti is in relation to fertility. So when Kshatakshina Samprapti lands up into fertility issue, then Amrita Prasha Grita happens to be the drug of choice. So there we gave that Amrita Prasha Grita for a duration of 1.5 months. The patient came, the couple, they came after 1 month. They came with a box of sweets with the good news. So the wife had conceived by then. So they told, like, they came with the sweets. So this is exactly, see, you know that you have planned or your Samprapti, the Samprapti what you have traced is right when you give the appropriate medicine. I told it is Kshatakshina Samprapti and I'm choosing the drug of Kshatakshina Chikitsa only. This means that, and if you are getting the response for that, this means that the Samprapti what you have planned, the Chikitsa what you have planned are in line. You are on the right track. Now this is what I meant to say, Samhita based clinical practice. Samhita guided clinical practice. You diagnose the case as Sandhigata Vata. You give Yogaraja Gugulu, Kaishwara Gugulu, something. That is, diagnose it as Amavata. Diagnose it as Vata Rakta. Change the diagnosis, adopt the Chikitsa. If that is done, then the approach is right. Okay. So this was another of the case which happened to be very interesting. So with the limited time of 1 hour, so I thought of discussing 3 of the cases. Fine. Now, how to initiate into Samhita guided practice? Again, people will have the doubt that whether we should know the whole Samhitas, every shloka, every text, everything referenced by heart. No. My advice to most of the students is short reading for long duration. What happens most of the time, what I observe practically is, students are in panic. They read the shlokas, they by heart the shlokas, they sit for hours, they bang their head and they learn the shlokas. Next day morning or next day they try to recollect the shloka, they won't be able to recollect it. They'll be in stress. Oh, yesterday I read the shloka, today I'm not able to recollect. They repeat the activity 2-3 times, they won't be able to recollect. Then they feel that even I read, or I don't read, I won't be able to recollect shloka. So close the book, no reading, no confusion. To avoid this, what I usually say is short reading for long duration. Read text every day for 15 minutes. More than enough. More than enough. Trust me, 15 minutes, just read it. Just read. Don't stress up yourself with by hearting the shlokas, mugging it up, nothing. Just read. And I say it is newspaper reading pattern. Just read text like newspaper. No need to worry much about what you have understood, what you have able to recollect, what you have absorbed, nothing. Just read the text like a newspaper for short duration of 15, 20 minutes or half an hour a day. Don't stress up yourself to try to recollect what I have read. Am I able to recollect it or no? You simply build up stress on yourself. Just keep on reading 10 days, 15 days, 20 days, 1 month. Gradually, you develop a rapport with the text. You develop what you call a relation with the text. You start recollecting the text. You start linking the references. You start creating the meshwork, a network of references. Number of references will come under one concept. You start understanding, analyzing the text very well. Issue is short step for a long duration. Daily reading for a short duration for 15-20 minutes, continue it for years and years and years. There is no end. Remember, always there is a beginning for learning the medical science. For Samhitas, you begin to learn, but there is no end. There is no end. Samhita reading will never end. Okay. So short reading for long duration, newspaper reading pattern. Just read like newspaper. Don't stress up yourself. Right? Avoid prejudiced thought. This is very important. Whenever we go through Raja Akshma Chikitsa or Raja Akshma, we are with the thought that Raja Akshma is tuberculosis. Everything you read, you link it to tuberculosis. No. Don't have that prejudiced thought. Come up with, be very blind or very blank and try to understand standing in the shoes of Acharya. Think of what they want to convey and try to understand that. Fine. So that is avoid prejudiced thought and read the text without any pre-thoughts that this is so and so. Fine. In ambiguity, as I told, there are many ambiguous issues wherein the contemporary or the present day practice are do not go hand in hand with what has been told in the text. So in ambiguity, trust the Shastra. The Shastras are ultimate. Today's research may be disproved tomorrow. A new research outcome may come, but the Shastra has never changed. You have editions in all contemporary texts. Edition 1, edition 2, edition 3. Charaka Samhita never saw edition. Sushruta Samhita never saw edition. It is the same Samhita since years and years. Some pathantaras are there, some difference of opinion are there, but the core text remains the same. That is a Shastra. So, in case of ambiguity, trust the Shastra, follow the Shastra as it is. Next is read, understand, apply. Ayuhu kamayamanena dharmartha sukha sadhanam Ayurveda upadesheshu videyaha paramadarha. Videyaha pata avabodha anusthana rupa. Pata, read the text. Avabodha, understand it. Anusthana, apply. Read, understand, apply. When you apply, you should get the response what has been told in the text. If you're not getting the response what has been told in the text, don't blame the text. It is the way of reading, the way of understanding is wrong there. So reread the text, re-understand it, change the understanding, reapply it. You'll get the response, surely. This is Pata, Avabodha, Anushtana. Read, understand, apply. There is no rocket science, my dear children. No rocket science. These texts are meant or they target the people of Alpa Buddhi. When you don't know anything, mere art of reading the text, mere simple art of reading the text is more than enough. No need of high level analysis, Tantra Yukti, etc. No. Basic. Read the text, understand, implement, apply, you get the response. If you don't get the response, reread it, re-understand, apply. You will get the response, trust it. Fine. So this is the method. The basic mantra here is read for a short duration every day. For a long duration is endless. Every day reading 10, 15 minutes, 20 minutes, sufficient, more than enough, more than enough. Okay. So with this, I'd like to thank all my gurus who have uh, motivated me to the clinical practice. So, and also I have to thank the team Ayuryana and my classmate who gave me an opportunity to express myself in this platform. Thank you. I think so if there are any doubts, I can go through it. If there are any queries or any doubts, you can ask.
No doubts as
No
such.
doubts as such.
Okay, okay, fine.
I'm still reeling from the mind-blowing session. The insights shared were impressive, empowering, and motivating, inspiring us to think in new direction. On behalf of Team Ayuryana, I extend my heartfelt gratitude to our esteemed speaker. Thank you, sir. Huge thanks to and gratitude to entire Ayuryana team for organizing this incredible webinar. Your collective efforts have made a significant impact. Dhanyavad to each and everyone.
Thank you.